So very often patients will come in and ask me specifically about veneers and how they work. They're interested in improving their smile and they want it done relatively quickly, and veneers is often the solution for them. Basically with veneers there are 3 appointments, and the first appointment is where we have a smile consult. We talk about your goals, what the look is that you're trying to achieve through veneering, and we do a full photo shoot. So it's going to be some face shots, some smile shots. I like to see where the edges hit the lip and how your smile is. Well, between the first and the second appointment, which is when we start, we have this wax sculpture created, and when it finally comes back from the lab after we've given them instructions, this is what we find. It's real exciting for us to open up and see where we're heading. Here's the before, where this patient has very worn teeth, they're chipped around the edges, and then the wax sculpture that is made to create the final template is like this. So there's the before, and there's the template for where we're heading towards the end. We prepare the teeth, and you have some temporaries that are made right off of this wax up. So you're going to go home immediately with a new smile. It's going to be whiter, brighter, and healthier. And then about 3 weeks later, we begin to make the veneers, and they'll come back in a nice protective little pouch. This is literally a smile in a box. And so here are the veneers. They're very, very thin. And then you come in, you get numb, we remove the temporaries, and then we place the new veneers on, and you have a new smile.